Hey, good afternoon, everyone. My name is Ty Harding. I'm going to be discussing Oaks Integrated Care, and the proposed project that I have would be to bring inpatient substance abuse treatment into the Oaks Continuum of Care model. Oaks Integrated Care is a 501c3 nonprofit organization based in Lumberton, New Jersey. Oaks provides mental health services and addiction services in 5 counties across the state. The primary focus of this proposal is the Addictions and Co-occurring Services program. Substance abuse is determined by the six multi-dimensions assessment using the American Society of Addiction Medicines, 6 dimensions, all right? Once these 6 dimensions are assessed, the diagnosis and level of care needed are determined. Just to give a little bit of background on the dimensions, we have dimension 1, which is acute intoxication and or withdrawal potential. 2, biomedical conditions and complications. 3, emotional, behavioral, or cognitive conditions and complications. 4, readiness to change. 5, relapse, continued use, or continued problem. And then dimension 6 is recovering and living environment. So moving on, the current services that Oaks provides are outpatient services for substance abuse treatment. They also have the opioid overdose recovery program, which is referred to as ORP. They also provide medication-assisted treatment, often referred to as MAT, programs like Courage to Change and Safe at Home, and support teams for addiction recovery, referred to as STAR, are also programs that fall underneath the Addiction and Co-occurring Services program. So getting into the issue here, these services are covered, only cover the first 2 levels of care under the ASAM Continuum of Care model. We mentioned it earlier in the presentation. The services needed based on the multidimensional assessment, based on what we're currently providing is, for prevention and early intervention. Then you have your outpatient and your intensive outpatient services. Getting into levels 3 and 4, there are no services currently that Oaks has that can provide for consumers with this type of need. So what can the inpatient services bring to Oaks consumers? Residential treatment services, you have clinically managed population-specific services, medically monitored intensive services, medically managed intensive services, and intensive psychoeducation in addiction and co-occurring disorders. The big idea here is for inpatient services to address the full continuum of substance abuse treatment services within Oaks as an agency. Some of the goals that we have for this proposal. The first goal is to provide substance abuse and co-occurring services that meet the treatment needs for all levels of ASAM criteria. One of the objectives would be to increase the exposure to multi-level of care treatment services by 20%. Moving on to goal 2, we want to provide rapid access to affordable care for individuals in New Jersey dealing with substance use disorder and retain a majority of those admitted. So we want to increase the average amount of days spent in treatment by 10% by December 2024. Third goal and objective is to provide inpatient substance abuse services to New Jersey residents in need of more intense levels of care. One of the objectives that we tied to this goal were to reduce the number of patients dependent on medically assisted treatment modalities containing addictive compounds by 50%. Some of the key lines from the budget and a quick timeline. Personnel expenses, of course, being the highest. That's going to be wages and salaries as well as fringe benefits, which is estimated to be about $112,000. Professional consultants are going to be your psychiatric folks, the program APN, responsible for managing the medically assisted treatment and the managed detox services. That's going to cost approximately $317,200. We'll have materials and supplies. That'll cost approximately $390,000. Facilities cost $269,550, with a miscellaneous expense of $250,000. Put the miscellaneous expense within the budget line, considering factors beyond control, and to give a little bit of wiggle room. The average rate of inflation is about 8% in 2022, so you take the total cost of the project, add on an 8%, and then tack on an additional 2.5%. Just to make sure that the agency isn't strapped for cash as we go to implement this program. So the total grant request would be $2 million. To start the program, we're first going to need to purchase a facility. Within 30 days, we would obtain licenses and inspections needed to start the remodeling and construction process. In parallel with that, we would be looking to staff the facility. A lot of the staff is going to come from existing programs within the agency already. The only staff that we would need to recruit from outside of the agency would be the cook staff. So anyone within the kitchen, and also we would need to hire 5 new certified recovery specialists to assist the counselor intern and the licensed professional counselor to manage clinical services for patients. However, we would expect within 120 days, 6 months of receiving grant funding, that we would begin providing services to consumers. I want to thank you all for your time. Really appreciate you listening in to my presentation, and hope everyone has a great day. Thanks so much.